Have you ever wondered why the internal jugular central line is so critical in healthcare? Let's dive right into it. The internal jugular central line, often referred to as an IJ central line, is a vital tool used in healthcare settings, particularly for critically ill patients. But you may ask, what makes it so significant? Well, its importance lies in its versatility. An IJ central line serves multiple purposes, one of which is medication delivery. In situations where rapid, high-volume or long-term medication delivery is required, peripheral veins may not be up to the task. That's where our IJ central line steps in. It can handle the delivery of these medications efficiently, ensuring they reach the heart directly and are quickly distributed throughout the body. Another key use of the IJ central line is blood sampling. Yes, you heard it right. It allows for frequent blood sampling without the need for repeated needle sticks, making it a less painful alternative for the patients. This is especially beneficial for those who require regular blood tests, making their healthcare journey a little bit easier. But that's not all. The IJ central line also plays a critical role in the monitoring of central venous pressure. This is a crucial factor in assessing a patient's fluid status and cardiac function. By providing direct access to the central venous system, the IJ central line enables healthcare professionals to accurately gauge a patient's condition and make informed decisions about their treatment plan. Despite its invasive nature, the IJ central line's benefits far outweigh its drawbacks, making it an indispensable tool in modern healthcare. From delivering life-saving medications to taking regular blood samples and monitoring central venous pressure, this line is a silent hero in patient care. So as we can see, the internal jugular central line plays a vital role in patient care. And understanding its significance is the first step towards appreciating the complex world of healthcare. So, stick around as we delve deeper into the fascinating aspects of the internal jugular central line in our upcoming scenes. The first step in the process involves choosing the right site for insertion. There are three main sites where a central line can be inserted: the internal jugular, subclavian, and femoral veins. Each site has its own set of advantages and potential complications which should be considered carefully. The internal jugular vein, located in the neck, is often the preferred site for a number of reasons. It's a large vein, which makes it easier to access and less prone to complications during insertion. It's also conveniently located near the surface of the skin, which can make the procedure more comfortable for the patient. Additionally, the internal jugular vein is less likely to be contaminated with bacteria than the femoral vein, reducing the risk of infection. The subclavian vein, found underneath the collarbone, is another potential site for central line insertion. However, it's deeper under the skin than the internal jugular and can be more difficult to access. There's also a risk of puncturing the lung during the procedure, which could lead to a pneumothorax or collapsed lung. The femoral vein, located in the groin, is the third main site for central line insertion. While this site is easy to access, it carries a higher risk of infection due to its proximity to the genital area. Additionally, patients who are obese or have a large abdomen may find this site uncomfortable. In the end, the choice of site depends on several factors, including the patient's condition, anatomy, and personal preference, as well as the healthcare professional's experience and comfort with the procedure. These factors should be considered carefully to ensure the best possible outcome. In the next segment, we'll discuss how to position the patient for the procedure, which is another critical step in ensuring a successful central line insertion. Stay tuned. Choosing the correct site is crucial to the success of the procedure and the comfort of the patient. Once the site has been chosen, correct positioning of the patient is paramount. Now let's delve into the specifics of how to position the patient for an internal jugular central line procedure. The recommended position for the patient is supine, or lying flat on their back, with their head slightly tilted to the side opposite of the chosen site. This position is preferred for a couple of key reasons. Firstly, when the patient's head is tilted to the opposite side, it naturally extends the neck, which opens up the area where the internal jugular vein is located. This provides a clearer, more accessible site for the procedure, making it easier for healthcare professionals to accurately insert the central line. Secondly, this position also helps to reduce the risk of an air embolism. An air embolism is a potentially serious complication where air gets into the bloodstream and can block blood vessels. By having the patient lie flat and slightly tilting the head, we lower the central venous pressure, reducing the likelihood of air entering the vessel during the procedure. It's also important to note that the patient's comfort should always be taken into account. Ensure that they are relaxed and comfortable in this position before proceeding. If they are tense or uncomfortable, it can make the procedure more difficult and potentially increase the risk of complications. In some instances, a slight modification to the patient's position might be necessary, depending on their unique anatomy or comfort. Always remember to be flexible and adapt the positioning as needed to best suit each individual patient. In conclusion, correct patient positioning is a crucial step in the process of inserting an internal jugular central line. It not only makes the procedure easier to perform but also plays a significant role in minimizing potential complications. Proper positioning not only makes the procedure easier but also minimizes the risk of complications. So, always take the time to ensure your patient is correctly positioned before beginning the procedure. It's not just about making your job easier, it's about ensuring the safety and comfort of your patient. Now that we have our patient positioned properly, we need to identify the anatomical landmarks. Let's start with the sternocleidomastoid muscle, a distinctive muscle that runs diagonally across the side of the neck. It's quite easy to spot as it pops out when a person turns their head to the side. This muscle acts as our primary guide, as the internal jugular vein runs just beneath it. Next up is the clavicle, or what we commonly refer to as the collarbone. This bone marks the lower boundary of our target area. It also serves as a protective shield for the vital structures beneath it, including the internal jugular vein. When we're inserting a central line, we always aim to stay above the clavicle to avoid any potential complications. Last but not least, we have the carotid artery. It's a major blood vessel that supplies oxygenated blood to the head and neck. It runs parallel to the internal jugular vein, but it's usually palpable and has a robust pulsation. It's extremely important to differentiate between the carotid artery and the jugular vein, as unintentional puncture of the artery can lead to serious complications. Now, why is it so crucial to accurately identify these landmarks? Well, the answer lies in the anatomy itself. The neck is a complex structure housing numerous vital organs, including major blood vessels and the windpipe. If we fail to correctly identify the landmarks, we could potentially puncture an unintended structure, leading to complications such as hemorrhage, pneumothorax, or even arterial puncture. Also, the precise identification of these landmarks aids in ensuring that the needle is introduced at the correct angle and depth. This not only increases the success rate of the procedure but also minimizes patient discomfort and reduces the risk of subsequent complications. So, always remember, the sternocleidomastoid muscle, the clavicle, and the carotid artery are your guiding stars in this procedure. Proper identification and understanding of these landmarks are the stepping stones to performing a successful internal jugular central line insertion. Identifying these landmarks correctly ensures a safer and more efficient procedure. We've chosen our site, positioned our patient, and identified our landmarks. Now it's time to insert the central line. This process is meticulous, but with proper care and attention to detail, it can be performed smoothly and efficiently. First, we need to ensure that we're working in an aseptic environment. This means properly cleaning the skin around the insertion site with an antiseptic solution, and donning sterile gloves, gown, mask, and cap. Remember, maintaining a sterile field is crucial in preventing infection. Next, we administer a local anesthetic to the insertion site. This step is vital as it significantly reduces the discomfort experienced by the patient during the procedure. We use a small needle to inject the local anesthetic, taking care to monitor the patient's reaction and ensuring that the area becomes numb. Once the anesthetic has taken effect, we make a small puncture in the skin with a larger needle, aiming towards the internal jugular vein. This step requires precision and a steady hand. We carefully advance the needle, keeping an eye out for the telltale flash of blood that indicates we've hit our target. With the vein accessed, we introduce the guide wire. This wire acts as a pathway for the central line. It's gently threaded through the needle and into the vein. The needle is then removed, leaving the guide wire in place. Finally, we insert the central line. The line is threaded over the guide wire and carefully advanced into the vein. Once the line is in place, the guide wire is removed. Throughout this process, it's important to continually monitor the patient's vital signs, checking for any signs of distress or complications. Remember, communication is key. Keep the patient informed about what's happening and always be ready to respond to their concerns or questions. And there we have it. The central line is in place, but our job doesn't end here. The central line has been successfully inserted. Now, our focus shifts to post-procedure care and monitoring. After the successful insertion of the central line, it's crucial to shift our attention to the patient's care and the monitoring of the line. This phase is as important as the insertion itself because it ensures the longevity of the central line and the well-being of the patient. Let's delve into the potential complications we need to keep an eye out for. Infection is a significant concern, as it can lead to serious health complications. Therefore, it's essential to maintain strict sterile conditions while handling the line. Regular cleaning of the skin around the line and changing the dressing as recommended are crucial steps in preventing infection. Another potential complication is the displacement of the line, either through inadvertent tugging or patient movement. To prevent this, the line should be securely anchored, and the patient should be educated about the importance of keeping the line undisturbed. Regular checks can ensure the line remains in the correct position. In addition to monitoring for complications, the line itself requires attention. Regular flushing of the line is necessary to keep it patent or open. This involves injecting a small amount of a saline solution into the line at specified intervals. This prevents blood from clotting and blocking the line, ensuring the smooth delivery of medications and other treatments. Remember, the patient's comfort and safety are paramount. Be alert for signs of discomfort or distress that may indicate a problem with the line. These could include pain, swelling or redness around the line, or a fever, which could signal an infection. Finally, it's important to note that the care and monitoring of a central line is a team effort. It involves healthcare professionals, the patient, and often their caregivers. Clear communication and education about the line and its care can make a significant difference in preventing complications. With vigilant care and monitoring, we can ensure the longevity of the central line and the well-being of our patient. We've covered a lot of ground today, so let's summarize the main points. We started our journey today by exploring the significance of the internal jugular central line. This procedure is a valuable tool in the medical world, often used in critical care settings to administer medications, fluids, and to measure central venous pressure. It's a lifeline for many patients, especially those in intensive care units or undergoing major surgeries. Then, we dove into the details of choosing the right site for insertion. The internal jugular vein located in the neck is often the preferred site due to its large diameter and direct path to the heart. However, other factors such as patient anatomy, medical history, and the healthcare professional's experience also play a crucial role in decision-making. Our next stop was the patient's positioning, a crucial step to ensure a smooth procedure. The Trendelenburg position, with the patient's head lower than their feet, is often used as it distends the internal jugular vein and reduces the risk of air embolism. Subsequently, we highlighted how vital it is to identify the anatomical landmarks accurately. The sternocleidomastoid muscle, the clavicle, and the earlobe form a triangle where the internal jugular vein is located. This understanding is fundamental to prevent complications and ensure a successful procedure. We then walked through the step-by-step process of inserting the central line. This involves prepping the area, applying local anesthesia, puncturing the vein, and inserting and securing the catheter. We also discussed the use of ultrasound, an invaluable tool that can guide the insertion, making it safer and more accurate. Finally, we touched upon the importance of post-procedure care and monitoring. Ensuring the line is secure, clean, and functioning correctly is crucial. Regular checks for signs of infection, displacement, and blockage can prevent complications and ensure the line continues to be a lifeline for the patient. In essence, the internal jugular central line is a complex procedure that requires a thorough understanding of the anatomy, precise execution, and diligent aftercare. It is not just about inserting a line into a vein, it's about ensuring that the patient receives the best possible care. We hope that this video has provided you with a comprehensive overview of the procedure. Remember, every step counts, from choosing the right site to post-procedure care. And while technology like ultrasound can guide us, the human touch, the attention to detail, and the commitment to patient welfare are what truly make a difference. The internal jugular central line is more than just a tool, it's a lifeline for many patients. Understanding its importance and the correct procedures for its insertion and care is key to providing the best possible patient care.